Hello class, my name is SergioLagasca, and for my anatomy signature assignment, I will be discussing with you acute renal failure. Before I move forward, I want to first break down the term acute renal failure. Conditions can be described based on their duration, and anything that lasts days, weeks, or even months can be considered short-term or acute. Anything that lasts a year or longer is considered chronic. The term renal is used to describe anything that relates to the kidneys, and barring any abnormalities, we are born with two of them. The kidneys are a part of the urinary system, as the picture on the slide shows, and failure is used to describe any reduced or diminished functionality of an organ. So, acute renal failure means sudden or short-term reduced functionality of the kidneys. Etiology. Although there are a countless number of reasons why acute renal failure might occur, they can all be classified under three main categories: pre-renal, intrarenal, and post-renal. Pre-renal failure occurs when there is an insufficient amount of blood flowing to the kidneys, and this can be due to a history of heart disease, such as heart attack. Intrarenal failure occurs when there has been direct damage done to the kidneys. This can be due to a history of kidney infection or excessive use of medications such as antibiotics, ibuprofen, or even diuretics. Post-renal failure occurs when there is an obstruction of the urinary flow. This can occur due to the development of kidney stones within the urinary system. Demographics. There are some factors that put the general population at a higher risk for acute renal failure. Some of those include an advanced age over 60 years, a history of pre-existing conditions such as heart disease and diabetes, a family history of renal failure, lifestyle habits such as smoking, and some studies have also shown that ethnic communities such as African Americans and Hispanics are at a slightly higher risk as well. Socioeconomic communities have shown to be at risk due to the lack of medical resources and available treatment. Anatomy. As I mentioned earlier, the kidneys are a part of the urinary system, which also includes the ureters, bladder, urethra, and in males, the prostate. The basic unit of the kidneys are the nephrons, and the smaller functioning units within the nephrons consist of the glomerulus and the tubules. Physiology and symptoms. The glomerulus of the nephrons within the kidneys is the functioning unit that is responsible for the glomerular filtration rate, or GFR. An impairment of this function causes an increase of waste within the bloodstream, which in turn causes an imbalance of electrolytes within the blood. This imbalance results in the presentation of the symptoms associated with acute renal failure. For example, an increase in potassium causes fatigue and abdominal pain. An increase of sodium causes inflammation and swelling of the lower extremities, the legs, ankles, and feet. And an increase of magnesium causes chest pain and an irregular heart rate. Diagnosis and treatment. The diagnostic tests that are performed to confirm acute renal failure include blood tests to determine if there's an increase of creatinine and blood urea nitrogen due to the impaired glomerular filtration rate, urine tests or urinalysis to determine if there's traces of blood, again creatinine, and the presence of protein. An ultrasound is performed to determine if there is a development of kidney stones, and a biopsy is done to determine if there is any cellular damage to the kidney tissue. The treatments that are common for acute renal failure include the administration of IV fluids to prevent dehydration, diuretics to excrete any buildup or excess urine, potassium binders to excrete excess potassium within the bloodstream, and also calcium supplement for low calcium levels. And lastly, these are my references, and that concludes my presentation. I hope that it has given you a better understanding of acute renal failure, if even just a little bit. Thank you for watching.